नमस्कार, मेरा नाम है योग आचार्य विनोद कुमार चिमुलकर। मैं आज आपके सामने जो खड़ा हूँ एक योग प्रात्यक्षिक दिखाने के लिए। सो योग इज़ अ वेरी इंपॉर्टेंट इन आवर लाइफ टू कीप वेरियस डिसीजेस लाइक अस्थमा, डायबिटीज, प्रेशर, kidney problem, cervical problem. There are many diseases. So to avoid these all diseases, it is very essential to do yoga. In yoga, there are different asanas and pranayam. So these yogas or asanas are divided into 4 categories. That is the standing position, sitting position, पीठ पर सो के और पेट पर बल पर सो के। इतना पूरा जो आसन है, जो आसन की प्रात्यक्षिकता हम आपको दिखाएंगे। सो हमारा जो शरीर, वट एवर अवर बॉडी इज कंटेन्स द 5 एलिमेंट्स, दैट इज पृथ्वी, आकाश, वायु, जल और अग्नि। तो इन 5 ही एलिमेंट से हमारा जो बॉडी कंस्ट्रक्ट रहता है, वो फिट रखने के लिए हमें योग और आसन का प्राणायाम बहुत इम्पोर्टेंस है। तो अब आपके सामने मैं कुछ स्टैंडिंग पोजीशन का 2-3 आसन दिखाऊंगा, बाद में बैठकर एक 2-3 आसन दिखाऊंगा, तो आप देख लीजिए। तो पहला आसन त्रिकोण आसन। कीप अ डिस्टेंस ऑफ 2-3 feet. Then bring both the hands towards the parallel to the shoulder, and now you have to bend to your right side. While bending, you have to exhale it completely and hold with the right hand your right hand ankle. This is the position. Now you can feel that from this side your pressure will build up. You can stay in this position for 10 to 20 seconds. So जो पूरा जो नर्व सिस्टम जो है फ्रॉम लेफ्ट साइड वो थोड़ा खींचता है, तो ब्लड सर्कुलेशन के लिए बहुत आसान है। अब ये आसन शुड बी अवॉइड द वन हु इज सफरिंग फ्रॉम अल्सर और हर्निया। Okay, now take a inhale it slowly. You have to come up and breathe out. Now in the same position we have to do the left side. Okay, breathe in, breathe out. Now take a long breath and slowly you have to bend it, and with the left hand you have to hold your left ankle. You can move hand backwards. You will feel that there is a stretching from right hand to the right leg. It will get tone जो pull होता है, इसीलिए वो circulation. And with this asan is a very helpful for the stretching of your chest and right side ligament and also left side ligament. While coming up, you have to breathe in slowly and relax. The next asan is a Tadasana. This is also a very useful asan for the one who is doing the Tadasana. While doing Tadasana, you have to stand in the Samasthiti position, then breathe in slowly and breathe out. Then take a deep breath, intersect the fingers and turn it. Now while breathing, you have to take a long breath and slowly you have to come up. Stand in this position for 10 to 20 seconds. Slowly breathe out, relax. In the same position, you can just pull both the hands without coming up. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Then again take a long breath. Take a long breath in your lungs and come up and stand on your toes. Slowly breathe out and relax. This is a very useful asana. While doing these asanas, whatever the nerve system behind from the toe to the brain, all veins are activated and the blood circulation gets easy to flow. The one should avoid these asanas. The one who is suffering from the varicose veins should avoid these asanas. This is a Tadasana. Now next asana is a Vrikshasana. Vriksh means paid. Take a long breath and breathe out. Lift your right leg. Just press it here. Balance your body with normal breathing. Now take a long breath. You have to stay in this position 10 to 30 seconds as per your capacity. At final position, you have to take a normal breath. Then breathe out and relax. This keeps your body in a balanced position, body and mind. This is also a very useful position. Now you have to change with the other legs, because our body is a component of two, that is a die. So now next, breathe in, breathe out and breathe in. In this position, you have to, your breathing should be normal. Breathe in and breathe out, relax. This is a Vrikshasana. Now next asana will be Ardha Vrishtasana. Before that, I'll take a Ardha Chakrasana. Keep your both the legs joined. Samasthiti. Your both the hands, the thumb of both the hands should be touched to this spine joint near hip joint. Then other four fingers should be here. Both the shoulders should be back. Now take a long breath. Breathe out. Now take the position while breathing side by side. You have to turn it, okay? Now take a long breath. You can bend as per your capacity. The person who is suffering from neck problem or the slip disc or the spinal problem or any injury at the abdomen should not do this practice. Now slowly you can bend your neck. This is Ardha Chakrasana. Now in this position you can stay 10 to 30 seconds as per your capacity with a normal breathing. If you can bend it, also you can bend it. But see that, take a care. While coming up, breathe in, breathe out and relax. With the help of these asanas, we can stronger our backside muscles and spine. The spine tissue, the spine muscles should be strong. The neck problem, who is suffering from the neck problem, he can do this asana very carefully. Now we'll do some sitting asanas. Sangachvadvam Sauvadatvam Samvo Manasi Janatam Deva Bhagam Yatha Purve Sajjanana Upasate Sajjanana Upasate Sajjanana Upasate Om Shant 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 धीरे धीरे आप अपनी आँख खुल कर सकते हैं। Now release your legs. Now we'll do exercise of the leg fingers. While pushing forward, you have to breathe out. While bringing back, you have to inhale. Okay? Breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, and breathe in. Breathe out. See that these nose, total nose from the top and the bottom should be straight. So they should be pulled. So there should be a pressure on the both the legs. Breathe out, breathe in, breathe out, and breathe in. Now rotation of the legs. 1, 2, 3, 4, 5. Opposite 1, 2, 3, 4, 5. अब 5 का one set you can do it. Next, lift your right leg, put it on left thigh. Keep your right hand here at the ankle side. Then rotate this 1, 2, 3, 4, 5. Opposite side 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Next, half Titli position, that is half butterfly position. With the help of left hand, just hold it here, and with the right hand, you just keep a right hand on the knee and press it slowly. While pressing it, you have to exhale. See, exhale it. I'll show you. So this bottom portion of this thigh should touch to the ground. Exhale, inhale, exhale, inhale. So slowly you can press it and see that this portion should touch to the ground. Once it is touched to the ground, you can easily do it. While doing, you have to sit straight, that your spine should be 90 degrees to this left leg. And relax. Now the second side. 1, 2, 3, 4, 5. Opposite 1, 2, 3, 4, 5. So whatever the joints are there, they should be activate. The same. With the help of right hand, just hold it here, and with the left hand, just keep your left hand at the knee and bend it. See that it should be touched to the ground. You can count in your mind 1 to 30. See, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Relax. Next, just put it right hand and hold the legs like this. A mother carrying a child at this position, and just rotate. While rotating in such a manner, you will see that your wrist also twisted. Relax. Now other side. Legs. Now hold the leg. Just move towards the upper side. Bring it. Hold both the legs with the hands of both the holder right leg with your both the hands. Turn it up, down, 3, 4 and 5. Relax. Now left leg. Breathe out, breathe in, breathe out. If somebody is suffering from the knee problem, he can do this slowly. It's a very good exercise for the knee problem. And relax. One, 2, 3, 4 and 5. Relax. 1, 2, 3, 4 and 5. Now the next asana is a Naukasana. While doing this Naukasana, you will feel that there is a pressure on the stomach. This is a Naukasana. You will feel that here you will get the pressure. So whatever the fats will be accumulated on the stomach will be reduced. Relax. Now the next asana, I will show you a Janu Shirasana. Before that, take a long breath and breathe out. So now I will show you next asana, that is a Janu Shirasana. The right leg should be folded towards this part, Janandriya part, and the left leg should be straight. Now take a long breath and turn to the right side. This is the position. Your spine should be straight. This is a very good exercise for your spine. So, if a person is suffering from slip disc, should avoid this asana. A person who is suffering from hypertension is also should be avoided. Now, take a long breath. Starting, you can just take a support of both the hands, touch to the ground, and bend from the wrist. While bending, you have to exhale it. Initially, you can do this asana slowly. See that there should not be any damage or pain. While doing this, see that if there is a pain, suppose now I am here and there is a pain at the back side, stop it. Stay in this position. See that while bending, you have to exhale. Now again you take a long breath. Exhale it. Inhale, exhale. Inhale, exhale. So at the time of exhaling, you can just see that your nose should be touched to the knee. So in this position, you have to stay 10 to 20 seconds with normal breathing. While coming up, you have to breathe in and relax. Once it is practiced, after some days, you can hold both the hands backside and take a long breath. Breathe out and try to touch your nose to the knee. You will feel that the total pressure will be here at the stomach and the pancreas. This is also a very good asana, the one who is suffering from diabetes. Breathe in and relax. Take a long breath, relax. In the same position, you have to bend forward and hold the thumb of your left leg. In Samasthiti, your spine should be straight. Now breathe in, breathe out. Again breathe in. Now you have to bend it forward. Exhale completely. Hold. These legs should be firm to the ground. So while bending, you will see that the arteries, veins will be stretched out of the spine and left leg. See, take a long breath and breathe out. Hold this leg like this. If it is not possible, it is here, no problem. As per capacity, you can just move it forward and hold it. This leg should not be come up, it should be firm to the ground. So whatever the nerve system will be stretched out, see that you will be, while doing this exercise, you will feel very good and better. Breathe out, inhale, breathe out, inhale, and touch your nose to the knee. While coming up, breathe in slowly and relax. Now we have to do with the second position. Move right leg forward, bring left leg to this, out of your Janandhya part. Take a long breath, turn to the left side. The same procedure. Starting also, you can just keep your both the hands on the ground for the support. Take a long breath. Bend from the wrist and slowly breathe out. Slowly breathe out. Slowly breathe out. See that your nose should touch to the left knee. Sit in this position for 10 to 20 seconds with normal breathing. Inhale slowly. Relax. Now you have to do without taking the support of the hands. Take a long breath. While doing this asana, we feel very happy, very happy. Breathe out, breathe out, breathe out, breathe out, and see that your nose should touch to the knee. Inhale and relax. Bring left leg forward. Relax. Now with both the hands, just massage your thighs and calf muscles. See that your muscles should be relaxed. This is the Janu Shirasana. From both the sides I have shown you. Now the next asana will be a Bhadrasana, that is a butterfly position. The ankle part should be touched to your Janandriya part, that is a reproductive part. Sit straight. Your spine should be straight. Head, spine should be straight. Both the thighs should be touched to the ground. If not possible, you can try it slowly. While practicing this in such a manner, you can slowly and easily you will touch thighs to the ground. This is the final position, which is known as a Bhadrasana. This is a very useful for the woman. At the time of pregnancy, she can do this asana, Bhadrasana, for the natural birth of baby. This keeps your mind and hip joint firmly. Spine will be erect. In this position, take a normal breath. With this asana, you will feel that from the head, thighs, calf, stomach and the spine will get a good exercise. The spine muscles should be strong. Now, the same Bhadrasana asanas, there is one more asana in the same position, Bhadra Bhunamasana. In this asana, you have to take a long breath and you have to bend it forward and try to touch your nose to the ground. While bending, see that a person who is suffering from the abdomen surgery, neck problem, cervical spondylosis or any surgery at spine should avoid this asana. A person who is suffering from the high BP should avoid this asana. If any person is suffering from the cardiac problem, should avoid this asana. Others can do this asana easily. Now while bending forward, you have to exhale, that is breathe out. First breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. It is possible as per your capacity. If you cannot move forward, don't move it, stay at this spot. If you can do it, you can do it easily. See that while bending, you have to breathe out. Take a long breath and breathe out. Breathe in and breathe out. And breathe out. See that your nose should be touched to the thumb of your leg. So here you will get, your spine will get flexible, your muscle of the spine will get strong. Slowly, slowly breathe in and come to the original position. Breathe out and relax. Now with both the hands, just put it under the thighs and bring it to the position. Relax, move forward with the legs. To get relaxation, after Bhadrasana, you can do it a chakki. Breathe out, breathe in, breathe out and breathe in. A person who can bend backward, no problem, as per his capacity. Now opposite side. Breathe out and breathe in, relax. So one more exercise to Bhadrasana for relaxed position. With the help of left hand, just hold it here. With the right hand, take a long breath and breathe out. Take a long breath and turn to the left side. In this position, you can take a normal breath. Breathe in and relax. Next side. Take a long breath. Breathe out. Long breath. Turn to the right side. Breathe out. With a normal breathing. Breathe in and breathe out. Relax. Take a long breath and breathe out. So after doing several asanas, it is very essential to have a long breathe and breathe out for relaxation of your muscles. Now we'll take one pranayam, that is Bhastrika pranayam. You can sit in Sukhasana, Siddhasana or Baddha Padmasana. You can sit in Padmasana. The benefit of this Bhastrika pranayam, you have to breathe in, breathe out, breathe in, breathe out. At the time of starting, you can do it slowly and gradually you can increase the speed. While doing this asana or a pranayam is a very beneficial for the lungs. You can improve your lungs capacity. Whatever the problems occurred at the nose will clear. Your mind and brain will be active. A person who has got a high BP or a heart problem should not do this Bhastrika pranayam. So I'll show you a Bhastrika pranayam. Sit straight, your full body should be loose. There should be no pressure on any part of your body. You can sit in Dhyan Mudra. This is a Dhyan Mudra. Thumb and the forefinger should be touched. Give a slight pressure on Mudra, this is Dhyan Mudra. First, you take a long breath and breathe out. Now slowly you can breathe in, breathe out. So I'll show you. Then take a normal breath. And relax. Now next I'll show a Vajrasana. This is also a very important asana. This is especially a person can do a Vajrasana after lunch or dinner. It's the only one asana. See that your these legs and this ankle should be, the thumb should be touched together and this ankle should be spread and this buttock should be fit inside this. This is the actual from the back side position. The front side I will show you. is a simple Vajrasana. This can improve your digestive system, constipation, and from anxiety also you will free from this asana. This is only one asana you can do after lunch, after dinner. So while doing this asana, see that a one who is suffering from piles should avoid this asana. A woman who is suffering from Ph.D. or the menstruation problem should do a Bhadrasana. The Bhadrasana asana which I have shown you is the best asana for the woman at the time of pregnancy or a one who is suffering from Ph.D. or a menstruation period. Now in this Vajrasana, your backbone will straight, erect, the spine should be very healthy. You should not give any pressure on your body. This is a Vajrasana. A one who is suffering from arthritis or knee joint problems should avoid this asana. Now one more asana. In the same position, I will show you a Mandukasana. This Mandukasana asana is very useful for the diabetic patient. One who has a high diabetes can do this asana, Mandukasana, and see that within a month or 15 days, the sugar level will come down. How to do the Mandukasana? Open your fingers, then you have to take a thumb inside this, and with the help of this forefinger, just close it. Now, with the help of this hand, जो नाभि का जो part है, that is the नाभि, just press it here at the pancreas side, there is on stomach side. Here there is a pancreas. Just give a pressure on your pancreas. Now take a long breath and breathe out slowly. This is the Mandukasana, a very useful asana for the diabetic patient. Slowly you can bring up your head. Stay in this position for at least 1 minute, if not 10 to 20 seconds at the time of starting. So in this position, take a normal breathing. While coming up, breathe in and relax. Again we will do one more time. Take a long breath. Breathe out. Take a normal breath. Breathe in and relax.